Bismillahirrahmanirrahim. Iyaka na'budu wa iyaka nasta'in. So in today's discussion, we are going to go through the algorithm for ventricular tachycardias. First of all, we know that tachyarrhythmias are divided based on the duration of the QRS complex, whether it is less than 120 milliseconds or it is greater than 120 milliseconds. These are basically three boxes on an ECG. If it is less than 120 millisecond, then that is a narrow complex tachycardia. If it is more than 120 millisecond, then that is a broad complex tachycardia. And broad complex tachycardias include ventricular tachycardia and fibrillation. Now, if the patient has ventricular tachycardia, we first have to look whether the patient is hemodynamically stable or not. That can be assessed by the blood pressure value given in the MCQ, whether the patient is conscious or not. And if the patient is hemodynamically unstable, then in that case, we will simply go for cardioversion, DC cardioversion, because this is a shockable rhythm. And if the patient is stable, then we have the important points of algorithm. The first thing that you have to assess is whether the patient has a structural heart disease or not. If the patient has a structural heart disease, then the preferred drug is IV amiodarone according to multiple guidelines. But the thing is that in the MCQ, they are not going to mention the word structural heart disease. They can use other terms which can refer to this, such as the patient has coronary artery disease, the patient had an MI in the past and now is on drugs, pharmacotherapy for prescribed by a cardiologist. Or they can also tell you that the patient is 70-year-old. If they have given an old age in the MCQ, then that itself means that the patient might have some coexisting atherosclerotic condition. So all these things refer to structural heart disease. In that case, you're going to go for IV amiodarone. But if the patient does not have any structural heart disease, they are not going to clearly mention that. They will be saying a young patient. Or for such ventricular tachycardias, we use the word outflow tract ventricular tachycardia. What are outflow tract ventricular tachycardias? These are specific types which only occur in younger patients. So either they will be saying a younger patient or they will be using the term outflow tract, and in that case, you're going to go for a beta blocker.